Everybody. Myself Dr. Rajan Vashisht. I am Senior Medical Officer Specialist. I am working as Senior Resident in Government Medical College. Today we are talking on hypertension. First of all, I would like to ask you all, do you have blood pressure? Most of you will say that yes, we have blood pressure. You are all right. But if I ask you, do you have elevated blood pressure or do you all have hypertension? I would say you all, you must think that you can have hypertension based on new hypertension guidelines which has been recently released in November 2017. So what are those guidelines we will be discussing, and what is basically hypertension we will be discussing, and what are treatment options we will be discussing, and what are the role of, what are basic changes these guidelines are made in diagnosing and management we will be discussing. These guidelines are basically evolving over many years. Basically, this time 21 scientists and health specialists over 3 years have made these guidelines, and it is basically released by American Heart Association and American College of Cardiology. They have released these guidelines, and after 900 published studies, they could define hypertension, which they said it is blood pressure of 130 by 80, which is defined as hypertension. Previously, there were many thoughts. We were not able to define exactly what level to achieve, what will be the minimum, what will be the maximum, but this time it is fixed at 130 by 80 to define as hypertension, and normal is 120 by 80. 120 is systolic blood pressure, 80 is diastolic blood pressure, and 120 to 130 is the range for elevated blood pressure, in which there is diastolic blood pressure is less than 80 and systolic blood pressure is raised above 120 millimeter of mercury. So this made almost 46% of US adult population hypertensive. So most of us may or may not be hypertensive, because not now, in the later ages we will be getting this hypertension, and this is nothing bad in labeling you elevated blood pressure or hypertensive, because this make you liable to have some lifestyle modifications and some changes in you, so that you can control your blood pressure, and so that you can control complications of this blood pressure, which can decrease your average number of life years. So if you are measuring your blood pressure and it is normal blood pressure, you are advised this time to check it annually. But if it is elevated blood pressure, it is more than 120 systolic blood pressure, you are advised to measure every 3 to 6 months. So there are different options you can go for measuring this blood pressure. First is simple sphygmomanometer. There are many monitors. If the clinic, in the clinic or in your first measurement, it is normal blood pressure, you can relax for 1 year. After 1 year, you need to check again. But if it is elevated, you certainly have to check it again and again. And other option, if there is option of masked hypertension, if there is masked hypertension is not revealed by routine measurements, but it is revealed by continuous monitoring. Like we have option of ambulatory blood pressure monitoring. Ambulatory blood pressure monitoring, continuously over a period of time blood pressure is monitored, and average of day and night is measured, and this is also able to diagnose some of the masked hypertension. And one is white coat hypertension. White coat hypertension is you go to the doctor and doctor says your blood pressure is elevated, but you go to home and you measure your blood pressure and it is normal. So most of the time the home blood pressure monitoring and ambulatory blood pressure monitoring helpful in differentiating the real picture of blood pressure. So when you go for blood pressure checking, there is some checklist before accurate blood pressure monitoring. You must sit relax on chair. You should not have smoked within last 30 minutes of your measurement. Your arm should be supported properly. Select the proper cuff size. Slow deflation of the cuff, and blood pressure measuring should be silent space. There should be no noise around your area where your blood pressure is measured. And every multiple measurements of your blood pressure should be at least 2 minutes apart. So based on your measurements, your blood pressure is grouped into normal blood pressure, elevated blood pressure, stage 1 hypertension, stage 2 hypertension, and some more severe form, hypertensive crisis. And normal blood pressure, I already told, it is less than 120 systolic blood pressure, less than 80 millimeter of mercury diastolic blood pressure. Elevated blood pressure is 120 to 129 systolic blood pressure and normal diastolic pressure of less than 80. Stage 1 hypertension is systolic blood pressure between 130 to 139 and diastolic blood pressure is raised above 80 up to 89. If it is more than 189, it is 90 diastolic, it is stage 2 hypertension, and if systolic is more than 139, 140 or more than 140, it is stage 2 hypertension. And these different group of hypertensions are dealt with different treatment approaches. We will be discussing later. First, I will stress on the need of cardiovascular risk assessment while you are being diagnosed with hypertension. If you have elevated blood pressure and you have diagnosed stage 1 hypertension, you must go for CV risk assessment, 10-year risk assessment of CV risk. If this risk is less than 10%, you are advised to engage yourself for lifestyle changes which can control your blood pressure. If your risk exceeds 10%, lifestyle changes and medication is advised to you, and your blood pressure is monitored frequently, like monthly, till it is controlled. And in stage 2 hypertension, you are given option of starting with, instead of one medication, double or triple medications. And in hypertensive crisis, it is very high blood pressure of 180 systolic or 120 diastolic millimeter of mercury. And this hypertensive crisis is a sort of emergency. You need to check end organ damage, your kidney, your eye, or main damaged organs, brain, stroke, heart attack, or other risk factors in case of hypertensive crisis. And you urgently need medical attention, you urgently need to go to hospital if you have hypertensive crisis. The risk factors associated to have a hypertension, there are a number of risk factors like aging. Aging is a very important risk factor. If you are 60-year-old or more, you are very likely to be suffering from hypertension, because the basic pathology of elderly hypertension is your stiff arteries, or narrow down your arteries by the plaques in your arteries. Ethnicity, the different group populations also predisposed to risk of hypertension. And your body size, obesity is very, very important risk for hypertension. Drug abuse, alcohol, tobacco, these are important and very common risk factor for hypertension, and their control is very, very important if the risk of hypertension is to be reduced. And among male and females, there is no difference of higher risk, but men are more prone for hypertension at a younger age, and prevalence of older women are higher in hypertension. The special conditions which are associated with hypertension are cardiovascular diseases, diabetes, chronic kidney diseases, high cholesterol levels. These all can lead to hypertension, especially if you get older. Other contributing factors like physical inactivity, a salt-rich diet associated with processed and fatty foods, low potassium in the diet, alcohol and tobacco use already told, certain diseases and medications can predispose to hypertension like cold medication, family history of high blood pressure is also very important contributing factor. Now question arises, what are signs, symptoms which can make hypertension diagnosed? Hypertension is basically a silent killer disease. Silent killer disease means hypertension mostly do not cause any symptoms. Most of the time you have no symptoms. When you check your blood pressure, it is either elevated or it is hypertensive. So don't go for weight, don't go for any change in your body for hypertension to be detected. Get yourself checked for your blood pressure. It is commonly said that sweating, anxiety, sleeping problems, blushing, these are common symptoms of hypertension, but in clinical practice it is not commonly seen these symptoms come out to be hypertensive. Headaches and nosebleeds associated with hypertension suggest us that some damage has already occurred by hypertension. Some of the long-term complications of hypertension are associated with atherosclerotic changes. Atherosclerotic changes in the vessels, formation of plaque which result in narrowing of blood vessels, which make this hypertension worse, and heart has to pump harder to deliver blood to the body. So this results in heart failure and heart attacks. Aneurysm among our major vessels which can dilate, rupture, it can cause our kidney to fail, it can cause stroke, it can cause our eyes, it can cause damage to our eyes, hypertensive retinopathy. So regulate blood pressure to control all these complications. So what are treatment options? Among the treatment options, most important is regulated diet. So regulation of our lifestyle modification, lifestyle adjustments are the standard first line treatment for hypertension. Regular physical exercise. Doctors recommend that patients with hypertension engaged in 30 minutes of moderate intensity dynamic aerobic exercise. This can include walking, jogging, cycling or swimming most of the days of a week, at least 5 days a week. Stress is also an important factor in hypertension, and avoiding stress is very, very helpful in control of blood pressure, and use of alcohol, drug or smoking to control the stress is very, very risky, and it can aggravate problem of hypertension. And smoking can raise your blood pressure. Giving up smoking reduce the risk of hypertension, and also many heart conditions, and also save you from stroke. So medications are needed if your blood pressure is more than 130 systolic and more than 80 diastolic. Drugs are usually started at single drug most of the time, but I already told you if you are in stage 2 and stage 2 with higher risk factor or stage 1 with very significant risk factors, you may be started with 2 medications. And over the time, single drug can be changed to double drug due to poor control on single drug. There are many drug options like diuretics. Among the diuretics, chlorthalidone is the best diuretic choice according to these guidelines. ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers are among the first line antihypertensive drugs. Beta blocker, alpha blocker, central agonist, peripheral adrenergic inhibitor, vasodilators are among others. And other drugs which we usually take over the counter, like we take cold medicines, or we take contraceptive medicines, we take steroids. These all medicines can hamper control of blood pressure, or they itself can cause hypertension or elevated blood pressure in an individual. Diet has very important role in management through lifestyle and dietary choices, engaging in physical activity, reducing alcohol and tobacco use, and avoiding a high sodium diet to control blood pressure. It is recommended to reduce your salt intake for control of your blood pressure. Average salt intake is average about 9 grams to 12 grams a day in most of the countries, and WHO has recommended to reduce this intake under 5 grams a day to help decrease the risk of hypertension and related health problems. This can benefit people both with and without hypertension, but those with high blood pressure will benefit the most. Alcohol should be moderate in quantity. It has many advantages, including control of your blood pressure. You should eat more fruit and vegetables and take less fat to control blood pressure. Other recommended dietary advices are you take whole grain, high fiber foods, variety of fruit, vegetables, beans, pulses, nuts, omega-3 rich fish twice a week, non-tropical vegetable oils like olive oil, skinless poultry, fish, low-fat dairy products. It is important to avoid trans fats, hydrogenated vegetable oils and animal fats, and to eat portions of moderate size. You should manage your body weight. Obesity is very importantly linked with hypertension. Hypertension is reduced by control of your weight. If you reduce your weight, hypertension is blood pressure level will decrease certainly. Hypertension has been typed in type 2, primary type hypertension and secondary hypertension. Primary hypertension can result from multiple factors, including blood plasma volume, activities of hormones that regulate our blood volume or pressure. It also influenced by environmental factors like stress and lack of exercise. But most of these are uncontrollable, so we have to take lifelong antihypertensives. But in case of secondary hypertension, there are specific causes, and the control of these causes make us control of hypertension and control of causes of hypertension, like diabetes, kidney diseases, cancer of adrenal gland like pheochromocytoma, Cushing syndrome, hyperthyroidism, calcium phosphorus level disturbance by hyperparathyroidism, sleep apnea, pregnancy. To know the causes of secondary hypertension, we need some screening tests like renal Doppler ultrasound, plasma aldosterone ratio, urine drug screen, 24-hour meta-nephrines, or to rule out obstructive sleep apnea, Berlin questionnaire. There is link of hypertension and diabetes also. Both diseases run together most of the time, and both have common risk factors, and both can be controlled by common lifestyle interventions. Diabetes does three things that may increase blood pressure. It decreases the blood vessel's ability to stretch, increases the amount of fluid in the body, and changes the way the body manages insulin. Hypertension and diabetes generally coexist because they share similar risk factors, including being overweight, following an unhealthy diet, and living an inactive lifestyle. So we need to look hypertension very aggressively in the diabetic patients. We cannot afford to elevate blood pressure in case of diabetic population. There are increased complication of diabetic, increased complication of hypertension, more heart attack, more stroke, if we do not control both at a time. Not smoking can help you a lot. Nicotine in cigarette raises blood pressure and heart rate. It also adds stress to the heart and increases the risk of heart attack and stroke. Smokers with diabetes have a higher risk of serious complications, including heart or kidney disease, retinopathy, and eye disease that may lead to blindness, poor blood flow in the legs and feet, which may lead to infection and even amputation, peripheral neuropathy or nerve pain in the arms and legs. People who smoke should make every effort to stop.